Research and Education Institute, and I'm working as a consultant ultrasonologist in Lahore, Pakistan. Let's discuss about the knee joint. For ultrasound of the knee joint, we scan ligaments, tendons, bursa, synovium and cartilage in the knee joint. But we have divided knee into 4 complexes. First of all is anterior knee complex. It includes Quadriceps Tendon, Patellar Tendon, which is from Patellar and it is attached to the tibial tuberosity. Divided into proximal and distal part for our convenience. The medial and lateral collateral ligaments or retinacula are very important for the stability of this knee, and we look for the stability of these retinacula. Here is anterior knee, and we can see there is prepatellar bursa, infrapatellar superficial and deep bursa, and suprapatellar deep bursa. We can see some fat just between suprapatellar bursa and tendon of the quadriceps, and a lot of fat which is called Hoffman's fat pad just below the patella and just below the patellar tendon. Cortical surface of the femur and tibia are very important to be assessed during this scan. So we scan these bursas and we scan the cortical surfaces, we scan the bone of cortical surfaces of patella also. Here are the prepatellar, infrapatellar, superficial, deep bursas. This is Hoffman's fat pad. For suprapatellar recess, we scan this area. The suprapatellar recess is a thin, hypoequic flat sac. It lies between the suprapatellar and the prefemoral fat pads. This is the recess. It is continuous with the knee joint. Here is infrapatellar recess and suprapatellar recess. Here you can see that. For scanning of suprapatellar bursa, we put our probe in this direction, we scan this area and we get this type of view. This is long axis scan for suprapatellar bursa. This is quadriceps femoris, its attachment on patella. This we get the cortical layer of the lower extremity of femur. And here is suprapatellar recess and bursa. For quadriceps tendon, if we scan in this area, we will get this type of view along with vastus intermedius, vastus medialis, vastus lateralis and rectus femoris. All these form quadriceps femoris. And this is the tendon. Here are muscles. If we scan it with panoramic view, you can get this type of view, and you can see that this is rectus femoris, vastus lateralis, vastus medialis and intermedius. This is how we scan. we get this type of view. Then for proximal patellar tendon, this is proximal patellar tendon, both has fat pad and the patellar attachment in the long axis. If we go distally, we have the insertion of this patellar tendon at the tibial tuberosity. This is the area which is being scanned. We can see the deep bursa. For extensor mechanism, you can have a better recognition of structures, better orientation of the things. Here you can see the skin. This is patella, quadriceps femoris tendon. Here is bursa, suprapatellar bursa. You can see the patellar bursa. Here is patellar tendon, the proximal part, distal part. We can see both fat pad and tibia. Coming to medial patellar retinaculum, we scan for this medial collateral ligament or retinaculum by putting the probe in this direction. The head of the probe is towards the lateral side, and patient is sitting relaxed with knee flexed at rest, and we get this type of view. Here is patellar retinaculum. Then we come to medial knee complex. In medial knee, we look for medial collateral, medial meniscus, and Pes Anserinus, which includes sartorius, gracilis, and semitendinosus. Here is a bursa which is just below these three tendons. For medial collateral ligament, we scan the patient in transverse, in short axis and in long axis, and here is the medial collateral ligament which we scan, and we get this type of view. Here is the meniscus, and you can see that, and this arrow indicates whole of the medial collateral ligament. There is panoramic view showing medial collateral ligament with medial meniscus. And for Pes Anserinus Complex, we scan this area for the sartorius gracilis complex, and here are that three tendons. The long axis. Then after medial knee complex comes lateral knee complex. We scan lateral meniscus, we scan this area for lateral meniscus and lateral collaterals, biceps femoris, and for iliotibial band. There are that areas which we scan, biceps. For lateral collateral ligament, we place our probe in this direction while having the patient lying supine and semi-flexed knee with a support below that. Lateral collateral ligament forms anterior limb of the lateral V with biceps tendon at the fibular head. We scan this area and we get this type of for the lateral collateral ligament. Here is lateral meniscus. These are muscle fibers and the bones. In panoramic view, you can see the lateral collateral ligament. For biceps femoris tendon, we put our probe here at the joint which is semi-flexed, and we get longitudinal scan of that. This is fibula and tibia. And biceps femoris shares a common insertion with the lateral collateral ligament into the fibular head. So you can see the biceps tendon along with lateral ligament inserting at fibular head. For iliotibial band, we need this posture just coming below the posture we needed for biceps tendon. We we get long axis of the iliotibial band. This is iliotibial band, and we